Assalamualaikum. I hope all of you are doing well. In this video, I'm going to teach you about the disease of nose and paranasal sinuses, out of which I'm going to teach you about the nasal septum and its disorders. Basically, you can see here, we can basically first of all discuss about the anatomy of the nasal septum. You can see here is the glomerular septum, here is membranous septum, and this all part is the septum proper. Now, let us talk about them one by one. So first of all, glomerular septum. Glomerular septum is here. This is glomerular septum. Glomerular septum basically is located at the glomella. You know about glomella. It is made up of the medial crura of the alar cartilages. And then we have the membranous septum. Membranous septum is basically freely movable. It has no bony or cartilaginous part. This is the membranous septum. Between the septum proper and the glomerular septum, we have the membranous septum. Membranous septum is freely movable. It has no cartilaginous or bony part. And then there comes the septum proper. Now, what is septum proper is made up of? Septum proper is made of perpendicular plate of ethmoid, septal cartilage, wormer bone, rostrum of sphenoid. All of these are contributing towards the formation of septum proper. Perpendicular plate here, so you can see perpendicular plate of ethmoid. You can see here the septal cartilage, and you can see here the wormer bone. Okay, the septal cartilage, the quadrilateral bit, basically it is wedged between the perpendicular plate of ethmoid and wormer. Okay, now further we have seen the anatomy of the nasal septum. Now we're going to discuss about the nasal septum. Now we will discuss about the location of the nasal septum. Basically, nasal septum lies anteriorly on the vomerine groove. This is basically vomerine groove. You can see here the wormer bone, and here lies the nasal septum. Any injury or any trauma or abscess or diseases such as the tuberculosis, etc., can cause the depression of the lower part of the nose. Here you can see depression of the lower part of the nose in all these conditions, and all the trauma and the injury also causes the dislocation of the septum, which lies in the midline. Okay, so moving further, we have discussed about the nasal septum, we have discussed about its location, we have discussed about the any injury or abscess or disease. And now we are moving towards the Little's area or Caselbeck plexus. It's blood supply. Discuss about the blood supply and nerve supply of the nasal septum. Okay, so first of all, we discuss about the blood supply of the nasal septum. Blood supply of the nasal septum. The arteries that supply the nasal septum are basically anterior ethmoidal artery, sphenopalatine artery, greater palatine artery, and branches of superior labial story artery. So these are the arteries which supply the nasal septum. Anterior ethmoidal, sphenopalatine, greater palatine, and superior labial artery. Okay, now let us discuss about the bleeding. What is the हमारे पास we have the question, we may get the question that what is the commonest point of bleeding out of these arteries. Basically all these arteries make epistaxis. Okay, anterior ethmoidal, sphenopalatine, greater palatine, and superior labial, all these make anastomosis. And what is epistaxis? Epistaxis is basically bleeding from all these arteries. And what is the commonest artery that participate in epistaxis, or what is the commonest artery in epistaxis is sphenopalatine artery. Now moving further, we'll see about the fractures of the nasal septum. Okay, so now we're going to discuss about the fractures of the nasal septum. Fractures of the nasal septum, any injury or any trauma can cause the dislocation of the septum from the vomerine groove. But there are basically two types of nasal fractures. One is the jar-away fracture. This is jar-away fracture shown in figure, and other is the cavillate fracture. Jar-away fracture. Jar-away fracture. Okay, as you can see here, and the other one is the cavillate fracture. We'll discuss here in the next video. Now the jar-away fracture starts from the anterior nasal spine, run horizontally, and ends here between, this is the wormer bone, This is the septal cartilage. It is between the septal cartilage and the vomer bone. This is the Darjavi fracture. It results from the blow, anterior blow. Runs horizontally. Again, I'm going to tell you that it runs horizontally from the results from the anterior blow, runs horizontally from the anterior nasal spine and ends between the septal cartilage and the vomer bone. Here it ends. This is the Darjavi fracture. Now, this is the cavallate fracture. It it results from the blow from the below, and it starts from the anterior nasal spine and ends at this junction. This is the bony part. This is the septum. It ends here. Anterior nasal spine to the junction of septum and bony part. This is cavallate type fracture. Now moving towards the treatment of the all the fractured parts, how they are treated. Treatment. So they are treated by the help of sutures. They are repositioned. Sutures. Repositioned. Repositioned by mucopericondial flaps. So their its treatment is this. They are sutured and they're repositioned by mucopericondial flaps. Complications. What are the complications if they are not treated? Complications. They may result in DNS, and they result in the asymmetry and DNS. That's all. If they are not treated. Now we are talk. Let's move towards. Now another topic is DNS. So what is DNS? Basically, DNS is deviated nasal septum. Deviated nasal septum. So the question arises is how the nasal septum gets deviated. In our previous video, in our previous topic, basically, we have discussed about the nasal fractures, nasal trauma. The first reason is the trauma. Any injury or trauma can lead to DNS. Trauma. In trauma, we have also during delivery. As during delivery the baby is passing through the birth canal, there is a reason that the nasal septum gets traumatized or injured here. The first reason is trauma. The second one is developmental error. Developmental error means developmental error here I'm writing delivery. D for delivery. Second is developmental error. Developmental error means that as you would know that there is any developmental error, then there is nasal then the nasal septum will not form in the midline, and there is deviation of the nasal septum. Why? Because during the formation of the septum there is the primary and secondary dentation. I'm not going into embryology. You can simply remember that there is an error in the primary and secondary dentation that results in DNS. And also in people who have high arched palate, there is DNS. I'll show you a picture in the next slide. There is a trauma, there is developmental error, there are racial factors, and there are hereditary factors. So there are four causes of the DNS: the trauma, developmental error, racial factor, and hereditary factor. I've talked about the trauma that during the childbirth there will be trauma and that results in the DNS. There is developmental error. We're not going into embryology. Simply there during the formation of the septum there is primary and secondary dentation, and there this error results in the DNS. And then racial factors and then hereditary factors genes play a role in the DNS. Family history you can take. I've talked about the high arch palate. So what do you mean by high arch palate? I'll show you. If the palate is high arched, then there's a probability of DNS. We are going to discuss about the dislocations in the DNS. We have talked about the causes of DNS. Causes of DNS include trauma, injury, or racial factors, or hereditary factors, or any developmental error. So these are four causes of the DNS. Now, What type of dislocation we see in the DNS? It may be interior dislocation, it may be C-shaped dislocation, it may be S-shaped dislocation, it may be nasal spur, or it may be thickening of the nasal septum. Now, what is anterior dislocation? Anterior dislocation is nasal septum is deviated anteriorly, and the part which has got the largest surface area or the widest surface area, we may see hypertrophy of the turbinates here. Hypertrophy of the turbinates in the part which has got the largest surface area. Anteriorly, here you can see the septum is interior dislocated, and the part which has got the largest surface area may have the hypertrophy of the turbinate. You can see here this is C-shaped deformity of the septum. Septum looks C-shaped. And here also one part gets more surface area, and obviously there is hypertrophy of the turbinates. There is also S-shaped deformity. There is concavity on one side on one side and C-shaped deformity. There is S-shaped deformity. There is nasal spur. Spur is basically projection. This is nasal spur. Spur is basically projection, or the nasal septum may get thick. So these all are deformities of the nasal septum. Either the septum get anteriorly dislocated, may go into the anterior chamber of the nose, may have C-shaped, may have S-shaped, maybe a projection or spur can be seen, extra projection can be seen, or spur can be seen, or there may be thickening of the nasal septum. There are the four deformities that occur in the heading of the DNS. Then we move towards the clinical features of the DNS. What are the clinical features of the DNS? The clinical features includes the nasal obstruction, the headache, headache, sinusitis. Okay, nasal obstruction. Why the DNS cause nasal obstruction? First of all, let us discuss them one by one. Nasal obstruction, headache, sinusitis, epistaxis, insomnia, middle ear infection. Why in DNS there is a nasal obstruction? Obviously, when the septum is dislocated or it is pushed to more towards one side, obviously there will be obstruction of the one side and there will be larger surface area on the other side. So obviously there will be nasal obstruction. Why the nasal obstruction causes headache? Basically, headache is due to a spur. We have seen a spur in our last slide, a spur which is usually a projection. When it touches the lateral wall of the nose, it causes pain or headache. This is basically due to the pressure. And why sinusitis? You know that sinusitis is basically infection of the sinuses. So when the sinuses opening gets blocked due to the deviated nasal septum, there is a probability that the deviated nasal septum may block the opening of the sinuses. So this will cause sinusitis. Nasal obstruction is due to the deviation towards the one side and that side gets blocked or obstructed. Headache is due to the pressure on the lateral wall of the nose by the spur or the projection, or sinusitis is due to the deviated nasal septum. The deviated nasal septum or the dexter part may block the opening of the sinuses, and you know that when the opening of the sinuses get blocked, we that recurrent infection of the sinuses, and that is sinusitis basically. Obviously, opening of the sinuses is blocked, so we get sinusitis. Epistaxis is bleeding from the nose. It is due to basically the drying effect. Basically, when the septum get deviated, this is my nose, okay, this is my nose, the septum get deviated, and suppose it is interior dislocation, so one side has get the larger surface area, and more or more air here led to the development of crust here, and when the crust here develop, there will be bleeding. So that is the cause of epistaxis. So far we have discussed about the nasal obstruction, headache, sinusitis, epistaxis, insomnia, because the septum may cause the failure of the inspired air to reach the sensory endings, and that causes insomnia. Nasal obstructions, headache, sinusitis, epistaxis, bleeding due to the larger surface area, development of more air currents, development of crust, and then epistaxis, and then insomnia. And then external deformity, obviously. And one thing you should remember in ENT, that eye, nose, and throat are interconnected. So the DNS also predisposed to middle ear infections. So these are the clinical features of the DNS. If the patient comes to you with a nasal obstruction, recurrent sinusitis, or having epistaxis, or is having insomnia, or having middle ear infection, or external deformity, you can see. So this is basically DNS. One test that we do is basically the Cotel test. Cotel test is basically in case of nasal obstruction, if we have to rule out that the vestibular part of the nasal cavity is blocked or not, we have to rule out if the vestibular part of the nasal cavity is blocked or not. We do the Cotel test. What is Cotel test? Cotel test. Cotel test. We draw the patient's cheeks laterally. If the breathing or the symptoms improve, then it means there is a vestibular part obstruction. We draw the patient cheeks laterally, and if the breathing or the obstruction improve, then the Cotel test is positive. It means that there is a vestibular part obstruction, because in case of nasal obstruction, we may get the vestibular part obstruction, or at the nasal valve obstruction, we get the choanal part obstruction, we get the turbinal part obstruction. The Cotel test is rule out what the obstruction basically of which part of the nasal cavity is having the obstruction. If the vestibular part of the nasal cavity is having the obstruction, then the Cotel test is positive. That's all about the DNS and the septal fractures. So in septal fractures, we had discussed about the Jarjaway fractures and Cavalier fractures. Jarjaway fracture and Cavalier fracture, we had discussed Jarjaway fractures start from the anterior nasal spine, run horizontally between the vomer and the septal cartilage, or it is due to the blow to the interior and anterior blow, or blow from the below horizontal Cavalier fracture. They start from the anterior nasal spine, runs vertically and ends at the bony and the septal part junction. Then we discuss about the DNS. We discussed about septal fractures treatment, that we treated with sutures and flaps. And then we talked about the DNS. Its causes are either due to trauma, either due to hereditary factors, either due to racial factors, or either during delivery it gets deviated, or during developmental error, that is embryological part. And types of DNS, we get the DNS, the septum got interiorly dislocated. It may got C-shaped deformity, S-shaped deformity, spur, or thickening of the nasal septum. Then we discussed about the clinical features of the nasal septum. Clinical features, we have discussed about the nasal obstruction, that is due to the more area on one side and other side get blocked. There is a nasal obstruction. Obstruction may be of any part, vestibular part, atic part, choanal part. To rule out the obstruction of the vestibular part, we do the Cotel test. We draw the patient's cheek laterally, and if the obstruction or symptoms improve, then we call that there is the vestibular part obstruction. Then we talked about the headache. Headache is due to the basically pressure of the septum on the lateral wall of the nose, or we can get recurrent sinusitis. Recurrent sinusitis is due to the blockage of the ostia of the sinuses, or opening of the sinuses due to the deviated nasal septum, or DNS block the opening of the sinuses basically, simply. So we can get recurrent infection of the sinuses. Epistaxis is bleeding. Bleeding is due to the crust formation, due to more air entering on one side, that is greater area that results in epistaxis. Then anzomnia is due to the failure of the basically air to reach the sensory endings due to the DNS, due to the septum, nasal septum. Then we have medullary infection, and that's all about the DNS. I hope you like the video. If you like the video, don't forget to subscribe the channel and like it, and